Welcome back. A recent measles outbreak has created concern and uncertainty across the nation. And today we want to answer some of your questions about the virus. So we're joined by Dr. Susan Girois, the director of Norfolk Health District, and she's going to try to answer these questions for us. One of the questions people had was, if you had the illness as a child, are you okay? Are you still, could you still get the measles?
Yeah, well, first let me take a minute and let's think about all those people who got measles and that family who lost a child in Texas.
Okay.
It must have been devastating. So
Absolutely.
I understand that there are a lot of questions out there that want to be answers. Now back to your question, if you had it as a child, you will not get it again. You're actually quite well immunized if you had it as a child.
The vaccine came out sometime, I guess, like in the 60s. If you did not, you're a baby boomer and you haven't had the vaccine, you should get it, or what's the situation with that?
Yeah, the CDC guidelines say if you were born before 1957, you most likely were infected with the measles virus, so you do not need to be vaccinated again. Now, there's a small population between 1957 and through 1968 who maybe there's a question whether they got the vaccine, whether they were vaccinated appropriately. For those folks, they should probably go to their doctor, get a blood test and see if they were vaccinated. You can tell from the blood test, or just get another booster. But your doctor would be able to tell you that.
So if someone comes in and they say, and they feel like they're fully vaccinated, they say, can I get a booster? What's the situation? Do you turn them away, or should people even be concerned about that?
Well, most folks in the United States who were born after 1968 probably were adequately vaccinated. But I'm going to say you really need to go back and get checked out with your provider. If you don't have a provider, you can come onto the public health department and we'll help you out there.
Tell me what the symptoms are.
Okay. Well, there are two main phases of measles symptoms. The first one is start with a fever, some runny nose, bloodshot eyes, and a cough. It sounds familiar, doesn't it? A lot of things can present that way. A couple days after that starts, then there's this fairly typical rash. It can start around the hairline, move down the face, and move all the way out to the extremities. The fever is often really high.
And the other question that people had, where there's some people are saying, is this going to be like the COVID-19 outbreak? Can we compare the two? Completely different.
It's completely different. First of all, measles is probably not going to be a huge outbreak here in Hampton Roads. We are a well-vaccinated, very protected community. In fact, across Virginia, we have about 95% vaccination rates across all of our children going into kindergarten. So we're pretty protected. That's not what COVID was. So I think we're well protected. There may be a case here or there, but you know, if you're coming down with a rash, your child is, if they've been vaccinated, it's probably not measles.
All right. Thank you so much. We appreciate it.
Thank you.